I'm Harry van Goor. I'm a surgeon and I'm a professor of surgical education at the surgical department of the Radboud University Medical Center. So my interest in viral transmission, bacterial transmission was already there from the beginning of my career. So I have really an interest in preventing of infections, and particularly surgical infections is a big deal. So when actually the pandemic started, we thought, okay, for extra measurements or extra measures to kill the virus, that would be a great idea, and that's the reason why we started with this, with using UVC light for disinfection. I have to say it's a very old technique because it's known already for years and years. When I started surgery, I knew there was UV light already during the evening when the ORs are not used. So it's quite old, but I think with modern technique, but also like this box, it's going very quick, and it has some certain features which makes it very attractive for applying this in care. Every department in this hospital, clinical department, has a problem of hygiene and infection prevention. Like the hematology department, like oncology department where they have chemotherapy and their resistance is low. But also at the surgical departments, orthopedic departments, where an infection is a very major complication, which gives a lot of decrease in quality of life of the patients afterwards. Actually, what we did is we introduced it very rapidly at the two COVID wards with patients with COVID disease. And there we cleaned or disinfect with the UV Smart the continuous monitoring devices. These continuous monitoring devices are worn on the wrist of the patients, and obviously these are also contaminated with the virus. So that was a reason for us to do an extra step in disinfecting these devices. But also there was an imminent need for tablets, patients using tablets, because then they were able to communicate with family at home, but also with nurses. And this was also a problem because these tablets are also contaminated with the virus. So we thought, okay, after a normal disinfection, we also do an additional UVC disinfection. And on the ward, it was very natural because when the nurses stepped from what we call the dirty area to the clean area, for instance, to have a break, then they saw the UV Smart box and they followed the step, put also their own devices in, but also the VisiMobile devices, and then went to the clean area, and then they brought it back via another entrance to the patient again. We recently sat together with the Department of Microbiology, the Hygiene and Infection sub-department, and we were talking about making the next steps. And there we decided that we are doing two parallel routes. We are going to implement it at the wards, at the surgical ward, but possibly also at the pediatric wards. And then we use it for additional disinfection. And the other route is a research route, where we want to ask some research questions about what is the added value. Can it replace maybe the normal disinfecting step? Is it more effective? And then obviously also, is it cost effective? I like it very much because it's quite easy. I put my smartphone in, and then after 25-30 seconds, take it out, and it feels very good. I mean, it feels like it's clean again. I can continue for the next 12 to 24 hours.